Answer questions 98 to 103 on the basis of the following information. You respond for a 44-year-old male diabetic who is complaining of a general feeling of weakness. During your questioning, you learn that he has been constantly thirsty and hungry. His breath has a fruity odor, and his level of consciousness appears to be diminishing. 101. Which of the following statements is the most accurate with regard to this patient? A. He has not eaten in a while, resulting in hypoglycemia. B. He has taken too much insulin, resulting in hyperglycemia. C. He has not taken his correct dose of insulin or is ill. D. He has taken his insulin but did not regulate his fluid intake. Answer. Seen most likely. This patient has not taken his insulin or has an infection that upset the glucose-insulin balance. 102. During transport, this patient slips into unconsciousness, and his breathing becomes very deep and rapid. What is this pattern called? A. Kussmaul's respirations. B. HHNK respirations. C. Shane-Stokes respirations. D. Christensen's respirations. Answer. A. Kussmaul's respirations are very deep and rapid and represent the body's attempt to compensate for the metabolic acidosis produced by the ketones and organic acids in the blood. 103. What does appropriate treatment for this patient include? A. and 4 of D5W or Ringer's lactate, oxygen, and IM glucagon. B. A blood glucose test for normal saline and a fluid bolus. C. A blood glucose test, 25 gm of dextrose 50% and limited fluids. D. Hyperventilation, limited fluids, and sodium bicarbonate. Answer. B. The appropriate treatment for this patient would be a blood glucose test, and 4 of isotonic crystalloid solution like normal saline, Ringer's lactate, or D5W, and an initial fluid bolus of 500 milliliters. 104. After a critical incident, of defusing should be done. A. 1 to 2 hours after the event. B. 8 to 10 hours after the event. C. 24 to 48 hours after the event. D. 60 to 72 hours after the event. Answer. B. A defusing is different from a debriefing in that they are held 8 to 10 hours after the event, rather than 24 to 48 hours. Defusings are more informal than a debriefing as well. 105. Asymmetrical movement during respiration typically suggests which condition? A. COPD. B. Flail chest. C. Brain damage. D. Hemothorax. Answer. B. Asymmetrical movements during respiration suggest injury to the chest wall. 106. Your patient suffers a head trauma that results in a transient loss of consciousness followed by a complete return of function. What is the term for this condition? A. Cerebral contusion. B. Epidural hematoma. C. Contractu injury. D. Cerebral concussion. Answer. D. A concussion is a brief loss of consciousness in response to head trauma. 107. What is the proper procedure for aligning a fractured long bone? A. Stabilize the entire limb in the position in which it is found, and then immobilize. B. Immobilize the limb with all the joints in the position of function. C. Immobilize the distal portion of the limb, and then move the proximal portion. D. Stabilize the proximal portion, and then bring the distal portion into alignment. Answer. D. Use gentle traction to bring the distal part of the limb into alignment with the proximal part. 108. When would you bandage and splint limb injuries on scene? A. Only if the patient does not need rapid transport. B. If the transport time will be longer than 1 hour. C. After treating any life-threatening injuries first. D. If the fracture has neurovascular compromise. Answer. A. If the patient's condition is such that rapid transport is necessary, you would care for limb injuries while en route, rather than completing a detailed physical exam and bandaging and splinting on scene. 109. What should you always do if your examination of a limb suggests that it is fractured? A. Apply traction to align the ends of long bones and position the joints. B. Treat it as if a fracture exists and immobilize it to prevent further injury. C. Check the proximal pulse, motor, and sensation, and adjust the position. D. Transport the patient as quickly as possible to preserve function of the limb. Answer. B. You cannot harm a patient by immobilizing a limb properly, but you may possibly cause further injury by failing to immobilize a fracture. Always assess the distal pulse before and after splinting. 110. Which type of wound would most likely require a tourniquet? A. Amputation of the hand at the forearm. B. Bilateral open fractures of the femurs. C. Below-the-knee amputation by a machine. D. Tearing injury of the upper arm. Answer: D. Because a tearing wound can tear multiple large blood vessels, bleeding may be particularly difficult to control, and a tourniquet may be necessary. Clean amputations often do not require a tourniquet. 111. A patient with hypoglycemia may present with which of the following signs or symptoms? A. Bizarre behavior. B. Blurred vision. C. Gradual onset. D. Bradycardia. Answer: A. Changes in behavior are the most common signs of hypoglycemia. Other signs and symptoms include diaphoresis, tachycardia, and headache. 112. What is the primary reason that diazepam is given to a seizure patient? A. To help relieve any anxiety that may be caused from having a seizure. B. To suppress the spread of electrical activity in the brain and relax muscles. C. To prevent hypoglycemia by allowing the brain to effectively use insulin. D. To help increase the blood pressure by lowering the seizure threshold. Answer: B. Although diazepam, Valium, does reduce anxiety, it is given to seizure patients to suppress the spread of electrical activity through the brain, as well as to relax the muscles. 113. What is the correct dosage and route of administration of epinephrine for a patient in anaphylaxis? A. 0.3 to 0.5 milligrams epinephrine 1:10, 000, administered intravenously. B. 0.1 to 0.3 milligrams epinephrine 1:10, 000, administered intravenously. C. 0.3 to 0.5 milligrams epinephrine 1:1, 000, administered subcutaneously. D. 0.1 to 0.3 milligrams epinephrine 1:1, 000, administered subcutaneously. Answer: A. The correct dosage and route of administration: 0.3 to 0.5 milligrams epinephrine 1:10, 000, administered intravenously, is given. 114. What is the role of beta agonists like albuterol in the treatment of anaphylaxis? A. To relieve anxiety. B. To prevent shock. C. To raise blood pressure. D. To reverse bronchospasm. Answer: D. Beta agonists such as albuterol are most frequently used in the treatment of reactive airway disease, asthma. They are also used to prevent or relieve bronchospasm and laryngeal edema in patients with anaphylaxis. Beta blockers are often used to control hypertension, but beta agonists are not given to raise blood pressure, making choice C incorrect. 115. During a multi-casualty incident, a conscious patient presents with a fractured femur, a palpable radial pulse, and a respiratory rate of 24 per minute. According to START, this patient would be placed into what triage category? A. Minor/green. B. Delayed/yellow. C. Immediate/red. D. Deceased/black. Answer: B. According to START triage principles, transport of this patient to definitive care can be delayed. He is breathing spontaneously, has a radial pulse, and is conscious. The fractured femur is not factored into the evaluation of transport status. 116. What do the symptoms of acetaminophen overdose include? A. Nausea, vomiting, malaise, diaphoresis, and right upper quadrant pain. B. Nausea, vomiting, confusion, lethargy, seizures, and dysrhythmias. C. Altered mental status, hypotension, slurred speech, and bradycardia. D. Nausea, dilated pupils, rambling speech, lethargy, headache, and dizziness. Answer: A. The most common symptoms of acetaminophen overdose: nausea and vomiting, malaise, diaphoresis, right upper quadrant pain are listed. 117. Pre-hospital administration of sodium bicarbonate may be ordered for a patient who has overdosed on which of the following drugs? A. Acetaminophen. B. Benzodiazepines. C. Narcotics. D. Antidepressants. Answer: D. Sodium bicarbonate is sometimes ordered in the field for ingestions of tricyclic antidepressants with cardiac symptoms, wide complex tachycardias. 118. Your patient is a 19-year-old female who has been stung by a stingray while swimming. What should you do after ensuring airway, breathing, and circulation are intact? A. Apply a tight, constricting band between the wound and the heart. B. Apply heat or warm water to reduce pain and detoxify the poison. C. Use an ice pack wrapped in a towel to relieve pain and swelling. D. Administer morphine sulfate IM or IM titrated to relieve pain. Answer. B. Heat will cause the poison to break down and lessen the harm to the patient. 119. Which drug can cause users to behave violently and aggressively? A. Elavil. B. Phenobarbital.
C. PCP.
D. LSD. Answer. C's PCP can cause bizarre delusions as well as violent and uncontrollable behavior. 120. Which of the following patients shows signs and symptoms of heat exhaustion? A. Male, age 34, severe muscle cramps in legs and abdomen, fatigue, and dizziness. B. Female, age 45, rapid, shallow respirations, weak pulse, cold, clammy skin, dizziness. C. Male, age 42, deep respirations, rapid strong pulse, dry, hot skin, loss of consciousness. D. Female, age 70, shallow respirations, weak, rapid pulse, dilated pupils, seizures. Answer. B. Rapid, shallow respirations, weak pulse, cold, clammy skin, and dizziness are signs and symptoms of heat exhaustion. Patients C and D show signs and symptoms of heat stroke, and patient A shows signs of heat cramps.